Video shows you how to do pre-procedure CT planning using the Redo TAV app. For the index tab is SAPIEN3 and second tab is ACURATE. When you click Redo TAV CT planning on the home screen, first you will get the overview of all steps you need to do. The CT acquisition protocol can be the same with routine pre-TAV assessment. It's recommended to obtain an ECG-gated multiphasic function CT that covers the entire cardiac cycle, with ideally 20 phases, a minimum of 10 phases. The mid-diastolic phase generally has fewer artifacts, allowing for better assessment of the prosthesis reflex and commissural alignment in most patients. The end systolic or end diastolic phases could be used as alternatives. The first step is index tab and measurement. If a pre-index tab CT data is available, select native valve morphology and the severity of calcification, and identify your patient index tab type and size. And then you will get the fundamental information of the valve. The leaflet of SAPIEN3 will extend to the top of the commissure tab when it's pinned out by a second tab. So the top of the commissure tab is the reference level for index SAPIEN3. On the next page, select the index tab failure mechanism and assess commissural alignment. Open your patient's CT dataset on a CT software. We can use any CT software. We just need 3D MPR multiplanar reconstruction module. After determining the appropriate cardiac phase, align the MPR to be orthogonal to the valve. And assess commissural alignment, which refers to the relations between the native aortic valve commissure and THV commissure tab. The commissure offset is directly measured using an angle tool with the limbs aligned with THV commissure and the native commissure of the RCC and LCC. This case has almost aligned commissures, so select aligned. And perform the measurement of area and perimeter. These measurements will be used for second tab sizing later. We can also understand how much the index tab is underexpanded at this point. For SAPIEN3, 3 levels require your assessment: outflow, base, and inflow level. Here is the outflow level, making sure the MPR is precisely orthogonal to the valve, and measure the area by tracing the center of the stent frame because of less blooming artifact. And you will get area and perimeter. Next, move to the base level, narrowest level. And again, measure the area by tracing the center of the stent frame. Adjust the tracing if needed. And lastly, move to the inflow level. Again, measure the area. After or during the measurement, please fill in the areas and the perimeter in the app. Step 2 is identify your patient coronary risk claim, which is defined as the lowest level of coronaries in relation to the SAPIEN3 reference level, where is the top of the commissure tab. On the CT, now we are in the inflow level. So scroll up the plane. Now we are reaching to the bottom of LCA. So align the MPR to the LCA to identify the relationship between the bottom of LCA and the top of the commission tab. So now the bottom of LCA is below the top of the S3 commission tab. Next is RCA. So scroll up again, and now we reach to the bottom of RCA. Adjust the MPR line and identify the relative relationship with the top of the commission tab. So the bottom of RCA is just below the top of the commission tab. In the app, select the bottom of RCA and LCA ostium, and the app automatically identifies the coronary risk plane. All commercially available toll valves could be selected as a second tab. No matter which toll valve is implanted, it will result in complete pinning out of the Sapiens 3 leaflet. So minimum height of the nail skirt will be at the top of the commission tab. When ACURATE is selected, it is crucial to align the bottom of upper crown with the top of the S3 stent frame to ensure the ACURATE expands properly. The inner skirt of ACURATE reaches to the bottom of upper crown. Therefore, the anticipated nail skirt plane for ACURATE in Sapiens 3 or MyVal combination is the top of the S3 stent frame. For this combination, there is only single selection for the nail skirt plane. This level is above the coronary risk plane in this case. So, further coronary assessment is needed. Step 5 is in vivo CT sizing. We already measured the areas and perimeter at step 1. In the app, these 3 levels are pre-selected for convenience. Please verify that the measurements are correct. If you'd like to, check the bottom of Include Perimeter. Click the Calculate button. Then you will get calculated average area perimeter as well as area derived diameter, perimeter derived diameter. Due to FDA regulations, the app is unable to directly suggest sizing. So you will need to choose the second tab size based on your CT measurement. Here are some guide how to choose size. And here you can get the IFU table too. For this case, I will choose size L, ACURATE Neo 2. It's generally less probable that an index tab will be expanded by a self-expandable second tab without performing either pre or post-dilatation. The BTA distance should be measured from the stent frame of the index and identify the narrowest BTA distance within the zone from the nail skirt plane to the coronaries. This evaluation is particularly crucial when the nail skirt plane is above the ST junction. The app is designed to automatically determine the relationship between the nail skirt plane and each coronary artery. When the nail skirt plane is above either the RCA or LCA, it's important to further evaluate the relationship between the nail skirt plane and the ST junction. We would recommend to assess RCA and LCA separately. So let's start with RCA. First, bring the plane to the nail skirt plane above the stent frame and assess the relationship with the RCA, which is just at the ST junction. So we need to measure the VT STJ first from the index tab stent frame and scroll down. Next is valve 2 aortic sinus. Scroll down and now it's a VTC measurement. So once you fill in these with the SUJ, with the AOS, VTC measurement, the app automatically identifies the nullest VTA values. Next is LCA assessment. So align the MPR to the LCA and bring back to the plane to the neoscat plane. And assess the VTA, assess the SD junction, which is just at the SC junction. So measure the VTA SUJ and scroll down and VTA AOS. Now it's at the VTC. And fill in the app. Then you will get summary report of 3 pages, which include animation representing the relationship between the neoscat plan and both corners. You can take screenshots and also import these reports into CT software summary report, like we mentioned. If available, the information of pre-index TAV CT can be gathered at step 8. This information can help you planning more precisely. This is all steps you need to do. I hope this video helped you planning the Redo TAV. Thank you.